Good morning, everyone. I'm Betty Stevens, and this is my persuasive speech. Addiction. Addiction, a public health crisis, not a crime. Addiction should be addressed as a public health issue rather than a criminal offense, as this approach reduces harm, promotes recovery, and fosters a healthier, more compassionate society. In the United States, someone dies every 7 minutes of a drug overdose. Today, I am here to argue that addiction is not a moral failing and it's not a crime, but it's a public health crisis deserving of our care and our support. This issue affects all of us, from rising healthcare costs to overcrowded prisons, and most importantly, the toll on human lives and the families. Criminalizing addiction perpetuates a cycle of incarceration, stigma, and relapse, trapping individuals and their families in a cycle of despair. According to the American Public Health Association, punitive approaches to drug addiction issues, relapse rates get higher and do not address the root causes of the addiction. Thousands of people with substance abuse disorders are incarcerated each year, receiving little to no treatment at all. They return back to their communities with no additional resources, leading to high rates of recidivism and overdose. Addiction is a chronic brain disease, such as diabetes and heart disease. The National Institute on Drug Abuse states that addiction is a complex disease of the brain and body that involves compulsive drug use despite the harmful consequences of those actions. Treatment and prevention are key. Imagine a person with diabetes being denied insulin. We would never do that. Yet, society often withholds care from those struggling with addiction, labeling them criminals rather than patients. Evidence-based treatment programs reduce substance use, decrease criminal behavior, and improve quality of life. Treatment and recovery programs, such as those offering medication-assisted treatment, can lead to stable recoveries to help individuals reintegrate into society as a contributing member. Studies show that for every dollar spent on addiction treatment, the community saves $7 on reduced crime and healthcare costs both. Many people argue that decriminalizing addiction will increase drug use. However, studies from other countries like Portugal show just the opposite. When addiction is treated as a health issue, drug overdose and substance use rates actually decline. In Portugal, where addiction was decriminalized in 2001, drug-related deaths and HIV infections have dropped significantly. This policy demonstrates that treating addiction as a health issue can be successful. Treating addiction as a public health issue rather than a criminal offense fosters a healthier society, saves lives, and reduces public cost. I urge you to support policies that provide medical and community-based services for those struggling with addiction. Let's work together to help create a future where we offer hope and help, and we don't offer those struggling with handcuffs. Thank you.